So Gemma House from the Public Health Research Programme. So I head up the team that looks after the application and funding side of things for PHR. So very briefly, two slightly quite new, certainly this one is very new, schemes that the PHR are currently allowing people to apply to is the Application Development Award Scheme. So this scheme is used where we've done some looking into the evidence of behind a certain problem or certain types of interventions, and we feel that there isn't enough underpinning work that's been done to enable us to write a full commissioning brief and expect the community, the research community, to be able to respond with a full-scale application or even a feasibility study. We feel there's actually quite a lot of work still to be done, which might involve sort of early scoping phases. And this scheme is a straight to stage 2 application, so it's quite rapid, but there is a bit of work up front to actually be able to do a stage 2 application. It's for up to 50,000 over 6 months. There's not a massive final report expected at the end of it. It's not a full NIHR Journals Library report. It's a shorter report that will just be put on the NIHR website on the project pages. So when applying to these application development awards, applicants are expected to be able to sort of put a clear link to how this award, if they were successful, would enable them to develop a full bid for the pending commissioned call. And that's key, I think. We need to be able to see that that line of activity that goes from the sort of the smaller award that we're advertising for in this development scheme through to the full evaluation later down the line when the full commissioning brief will be advertised. To aid that, because we recognise that obviously you might not know quite how the commissioning brief is going to be phrased and targeted, we do advertise the commissioning brief that we will advertise at a later date for you to submit to as part of this package, so you can see what will be advertised later down the line for you to apply to, and we think that's quite important that is there and visible. So we have we've previously had one of these calls which successfully resulted in one application being funded. And then we've got 2 which are live at the moment. So we have an application development award in mental health and wellbeing, specifically in young women, which closes in August. And then we have another which is to do with core outcome data sets for population health research, which again closes in August. And they're both available to look at on the website. So moving on, the rapid funding scheme has been around for longer. So it's quite well established. It's similar to the previous scheme in that it's £50,000 over a duration of 6 months, straight to stage 2 application. Is open for anyone to access should they be able to convince us that they should be allowed to access it. So you can't just submit an application to this scheme. You are asked to write a 1-page summary of why you want to apply to this scheme and how your proposal will actually fit in with the dynamics and the scope of this scheme. So this scheme really looks at baseline data collection or early feasibility work for time-limited natural experiment opportunities. So when you write your 1-pager, you would need to convince us that this is a unique time-limited opportunity. So for example, if a local authority is about to embark on an intervention, say putting cycle routes or something in the next 6 months in a local area, and you want to collect some baseline and some early feasibility work before they do this, you could apply probably to access this scheme. That seems like a likely intervention that would need to be rapidly evaluated. When you do apply to this scheme, you'd also need to convince us that you've got a clear route to a full application later down the line. So once you have completed this 6-month bid, we would expect to see a full application for either a full feasibility trial or more likely a full trial or study of some description. And that link really needs to be clearly articulated in the one-page summary that you provide to us. Otherwise, we'll probably go back and ask you for more detail, but that is key to being able to access this scheme. So yeah, once you send your one-page summary in, we have a conversation internally with the team in the office to see whether we feel it meets the requirements of the scheme. If we feel it does, or it's likely to, we will share the one-page summary with the programme director, and then Brian will sort of have the final yes/no as to whether we can open a stage 2 application for you to complete. And then the proposal, because these come in sporadically, so they don't go unless the timing's right, they don't go to a funding committee or a prioritisation committee, they go to a subcommittee. So we convene a small group of our experts to look at them outside of our normal processes. And I suppose that really chimes to the kind of time limited opportunity that they highlight. So I think that's probably it on that one. We have funded a number actually over the last few years. The scheme, as I say, has been going for at least 3 or 4 years, I think now. And so this is just an example of ones that we've funded. And then with many of them, we've gone on to fund a full study later down the line.